Ramadan this year? If so, then I have few health tips that will help you get the most health benefits out of your fast and avoid unintended side effects. My name is Dr. El Mohandes. I'm an integrative medicine practitioner, doctor of physical therapy, certified medical nutritionist, geriatric specialist, and certified clinical educator that teaches continuing medical education courses. I'm the founder and chief wellness officer of Holistic Rehabilitation Services that serves the DC metropolitan area in the United States. So when you break your fast, best way is to drink a cup of water followed with 1 or 2 dates, not too many dates, to avoid sugar spikes. And if you mix your dates with a handful of nuts or some plain Greek yogurt, that will help slow down the absorption of the sugar into the bloodstream, preventing sugar spikes, especially if you're diabetic. Number 2, you want to make sure that you are drinking enough water and fluids, non-caffeinated fluids, during the non-fasting period. That is really important to keep you hydrated. So instead of just gulping on water at iftar, you need to sip on water throughout the non-fasting period. And you can drink water if you add a pinch of sea salt to the water. That will help you rehydrate better. Or coconut water is a great idea. Gatorade with no sugar added is also a good idea. Herbal tea is also a good idea. Just try to avoid caffeinated drinks because the caffeine will dehydrate you. When it comes to fried food such as samosa, burek, and others, I know it's very hard to avoid, so just be moderate. 1 piece should be enough, and make sure that you eat it with a balanced meal. And do not start with such fried food. Always start with after you break your fast, something light like soup or salad. Start with your vegetables, followed by lean protein and healthy fats, omega-3 fatty acids such as avocado and olive oil, and then end with the carbohydrates. This will help stabilize your blood sugar and avoid sugar spikes. If you have to eat sweets, eat them after you finish your iftar, because this way you will have enough fibers to slow down the absorption of the sugar from the sweets into the bloodstream. I'm not telling you not to eat sweets. I know it's very hard. It's a tradition of the month, but just be mindful as to the amount and the sequencing of what you eat. Then you also want to make sure that you chew your food well. Do not fast eat your food, because when you eat fast, you end up getting over full or stuffed. And this overeating will lead to bloating, will lead to indigestion, will lead to weight gain, which is something we want to avoid during this month. Actually, you should be able to lose weight, not to gain weight during the month, something that does not happen. Actually, people end up gaining more weight during the month of Ramadan after 30 days of fast, because not paying attention to these little tips. Also, you want to make sure that you're getting enough sleep, because when you lack sleep, that messes up your hunger hormones. You end up feeling more hungry, and during iftar you end up inadvertently overeating. If you are on medications, please do not revise your medication time without speaking to your healthcare provider first. That's very important, especially if you are diabetic. It's always a good idea to go for a 10-minute walk after iftar. Even if you walk around the house, get up and walk, because when you move your big muscles in the legs, they will get the excess sugar out of the blood. They will use it, so this way it will help stabilize your blood sugar. For those who go for prayers after iftar, to pray Isha and Taraweeh, That's a great practice because as they contract their muscles, the muscles will be directly using the excess sugar in the blood, helping to further stabilize blood sugar and prevent weight gain. Well, for everybody who is fasting this blessed month, I wish you a joyful and peaceful month. And I wish that the month of Ramadan brings more peace and stability to our troubled world.